Let's get into our next conversation for the hour, which is around type 1 diabetes, specifically in children. And we have Eric Omondi, who is a type 1 diabetes awareness champion. Good morning, Eric.
Good morning, Miriam.
Good to have you in studio, Mariam. It's nice to have you in studio. We usually welcome our guests with a quote, and I'll share the quote of the day with you. Okay. You can say if it speaks to you, if you agree with it or disagree. Okay? Today's quote comes from a Senegalese poet who was also a veterinarian and a diplomat, so a man of many talents. His name was Birago Diop. And he said, "The fire from the wood one has cut themselves always seems warmer than any other fire." The fire from the wood one has cut themselves always seems warmer than any other fire. Do you agree?
I relate. Thank you. I agree.
Yeah, you relate?
Yes.
Okay. I love it. Speaks to the work of your own hands, right?
Definitely.
Yeah.
That's why I'm here.
The things that you do. Eric, you were diagnosed with type 1 diabetes some years back.
Sure.
Tell us when.
This was way back in 2003. I've been lived the symptoms for more than 1 year. And by then, because we didn't know, so we could not actually trace it when. But growing up in the village, so in Siaya, I would be treated for malaria. This was during the fansida treatment. So I would take it almost every month. I would be treated for fansida that. And luckily, I did not suffer from one of the side effects. You could suffer from those side effects.
True.
But I never improved. So I remember my mother and fellow mothers in the village discussing that this malaria has become stubborn in Doluo. This is mature malaria in Doluo. Malaria no tegno. Tegno. Mature. Malaria mutegno. That's mature, stubborn malaria, which I got treated for long. Luckily, I did my class 8, and I got admitted to Lena School in Form 1. This deteriorated very fast. I became very sick. Performance dropped. Everybody got worried. And by then there were still some elements of bullying, and people think, oh, maybe he's being bullied. Maybe the study in national school is difficult for him. He's not able to cope. Boarding school is not able to. So the symptoms will always be ignored. And the three common symptoms are persistent thirst. But people will tell that again, thirst, maybe because with thirst you'll take more water. Yeah. They think that it's more of habitual. Definitely when you take a lot of water, you will pee more. Again, the next symptom is frequent urination. Third one, then you are losing weight. But in early stages, at some point, you also have persistent hunger. But they will be wondering, why are you eating? You have appetite, and yet you're not even adding weight.
Right.
So they will be dismissed at that point. By then, there was not much information. Closest to diagnosis I got was, he could be suffering from Chira. Do you know Chira?
Chira.
Yes, a taboo in Doluo. That was the closest to, apart from the malaria now. The next diagnosis I got was maybe he could be suffering from Chira. Then that would mean that they will have to do some kind of rituals.
Tambiko.
Yes, Tambiko here and there, some prayers here and there. And 2003 September, it got worse. I haven't written the symptoms down. I even started bedwetting, something which I had stopped long ago in Form 1, at school, even at home. So I did some of these symptoms down. A relative takes me to Bagadi.
How old were you? Sorry.
By then I was 17.
17 years old.
Yes. Takes me to Bagadi Hospital. I read them under the table because whenever I would present it to my people, they will dismiss them. So I was also somehow getting ashamed of them. I didn't even finish the list.
Yeah.
And the doctor asks, "Do you have diabetes?" No, I don't know. Anybody? Because I don't know. I didn't even understand what is diabetes. So I said no. I'm sent for blood sugar test only. Sugars were high, around 22. I'm given some tablet for 1 day, booked for a review. They're still high. I'm admitted for 1 month. Put on injections. Injectable insulin because type 1.
Right.
The treatment is insulin, which is injected. So it was the end, like maybe 1 day to discharge. I'm now being prepared for the discharge. I'm told possible outcomes, complication. Where I almost melted. Here you can have your legs amputated. You can go blind. Some of the outcomes. Then I'm told I'll be injecting myself. I was on a shot, so the first injection I did on my thighs, I was shaking, I was trembling. And I'm told you'll be doing it yourself twice a day. I'm discharged. But by then I'd really improved. The one good thing is that I'd really improved. I've never seen myself that handsome.
I'm sorry to stop you. Let me take you back because where were you before you got to Mbagathi? Where did you come from to come to Mbagathi
From
Hospital?
school.
From school?
From school, yes.
Okay, which
I
high school was this?
sick. Lenana School.
Lenana School.
Yes.
And they took you to Mbagathi?
No, my relative now
Okay.
went back home to my relative in Nairobi because my parents are still and were in the village in Siaya.
In Siaya?
Yes.
Okay. And they took you to Mbagathi. You're admitted for 1
1 month, yes.
And what's happening during the course of this 1 month? What kind of treatment are they giving you?
I was being injected, if I might not remember very well, but at least twice a day. In the morning and in the evening. And then I would be checked. I would go to the lab, checked, and I was really improving. I really improved. Yes.
Okay.
Yes.
Wow. Walk me back now. Let's go to the day you were discharged. You said you'd never looked so handsome, yeah?
yes. I added weight and
Yeah.
because one of the symptoms is an unexplained extreme weight loss in type 1. Yes.
Okay. Let me go back to what type 1 diabetes is, because you said at the beginning when you explained your symptoms and the doctor is asking, do you have diabetes? You don't even know what that is.
Don't even understand.
Now you do.
Yes.
Explain what type 1 diabetes is.
Type 1 diabetes is a condition, medical condition, which occurs when our body loses the ability to produce insulin. Almost absolute no insulin production from the pancreas. Insulin is the hormone which helps balance our sugar levels by letting our body to utilize it. So when you lack the insulin, the sugar will remain in your bloodstream. After eating, it is digested, which is very common in most of our food, most of our food contain carbohydrate.
Of course.
This sugar needs to get from the bloodstream to the cells or to the body or to the flesh now to be utilized where it is intended as a fuel or battery to your body or for energy. So if you lack this insulin, it will remain and accumulate in your bloodstream at very high level. Yes,
It
that's
remains
what is type 1.
So it remains in your bloodstream.
Yes.
And you were told, you know what, we have to keep you here for 1 month. Then you're discharged. Then you're told now you have to be treating yourself twice a day, every day with an insulin shot. We've not talked about the cost of these things.
Sure.
Walk me through.
First of all, they did not keep me there. They did not anticipate even keeping me there for 1 month. In fact, I was discharged due to risk of acquiring even other infection, what they call as nosocomial infection medically. I did not completely stabilize to be discharged, but they said, look, we keep him here long, he's even risking getting
Other infections.
Mbagathi being also public hospital by then. I did not that the sugar levels are not stabilized to the level of discharge, but they had to do it just to keep me safe.
Right.
Yes, the cost was not discussed. But then we didn't even know about it. Then there is also the issue of injecting. Again, the information, as at now, looking back, the information was also not that up to par. First of all, the treatment, by then, currently is not even recommended. It was, but that's what was available. It was not adequate. They didn't talk about glucometer, the machine which you need to check your sugar levels. You see, a normal person, your brain balances automatically. It's like in the case of a fridge, we have a thermostat.
Yeah.
So in our bodies, we have also that system, which brain, if your sugar level is rising, it switches it off, it switches it on, like that. So in a case of a type 1 diabetes, that element is lost. So you need a glucometer to help you to visualize where am I. And even now, that has been overtaken. Now there's what we call continuous glucose monitoring, a CGM, something you wear throughout. Which
I've seen people wear it as a
yes.
like something
A
on
patch,
the patch on the
patch
arm.
on the arm, yeah.
Yes.
Which helps you to visualize that, what our brain does. So that way they don't even talk about it because of the cost, by then even the level of knowledge. So currently, a patient without that glucometer will end up in problem. They are lost. It's like walking in the dark, or with your eyes blindfolded. That glucometer. So I'm only given the insulin. They don't talk about the cost. First of all, by then even the government hardly used to stock it. It will come once, maybe twice in a year in the government facility. So we look for it. We really wait for it. And sometimes you get a network of patients. So, inapatikana hapa. You go for it. And by then the price was ranging from 1,000 up to 2,000. By then,
per dose.
Money, no, per vial.
Per vial.
A bottle which last average of 1 month could even be less depending on your dose. But mine was lasting for 1 month. By then, it was a lot of money.
That's 2,000 shillings a month is a lot of money.
You're not factored in the needle because it is injected.
Yeah.
And you need to inject once and you decide. So 2 needles per day, average of 20 shillings.
Wow.
Each.
So let's go back. Actually, let's look at those numbers then. Okay. So when you were in hospital, of course, they were not charging you.
Okay, but the bill was there.
But there was a bill, right?
Yes, yes.
So every day they're just coming, they inject
Yes,
you, they
yes,
go,
sure.
they give you food. Da. At the point of discharge, do you remember the bill?
I can't remember the amount, but I remember it was waived. We could not manage to raise the bill.
So they had to waive it.
Yes, we
Because they
waived
looked at your condition
Yes.
and your
Background.
background, and they were like, all right. But now, from this point on, would you sort?
Could you sort us?
Now, are you going back to Siaya at this point?
No, I'm in school in Nairobi.
He's in
So,
Banana.
so are you going? So were you discharged and to go back to Landana,
Yes.
or did you go back to?
Back to it was around September, third term.
Okay.
So 1 month around end of I remember it was towards the end of October, towards the end of the term again.
Yeah.
I went back to school,
Okay.
did the final exam, then holiday.
And you went to, with a couple of doses,
Yes, one vial.
one dose,
Called 1 month dose.
which is part of what has been waived.
November. Yes, it has also been waived.
How many syringes and needles did they give
I
you?
can't remember, but
they gave you a
they only packed like 10.
They gave
on
you
average,
four.
like 10. Yeah.
When you finished, did you go back for some
So-
more free medicine and free syringes?
I resumed school. November. This one dose lasted for part of October and November. 1st December 2 or 3, my last dose. I think in the morning.
Wow.
I'm in Nairobi with my relatives here. I moved back to Siaya for
holidays?
No further review with the clinic. I worsened. You just like dropping like from grace to grass. Sharp, deep dive. From that handsomeness back to those symptoms. No, my policy that no, this drug is bad. It's addictive. That's how they will describe insulin.
Oh, wow.
Yes, so they will also discourage me.
They don't
go
want you to
back
keep
it.
taking.
Yes, because why are you worse? No, if over the years, if you develop a system over the symptoms over the years, it is slow. So people don't realize.
Yes,
It
yes.
becomes like part of you.
Yes.
I remember even my late elder brother cracking a joke in the village that they should add some flour, unga ya ugali, to my bathing water because it seems I'm not absorbing through my stomach. That's how I was. Nioke nayo ni meze kwa you add some weight. So that even now they say I'm now fat.
When you came back now for Christmas, yeah, when you went now for the holiday, right? They saw a different person from the guy
Yes.
who left here to go for the third time.
Yes.
But you have come home without
Medication.
And they don't know at this point that you've been injecting yourself twice a day and so on and so forth.
They know because they know.
You told them.
But they are against it. They are
But they have not
wondering.
seen you do it.
Yes. They've not seen me do it.
So what are you saying that throughout that holiday period in December, you did not take
I did
any
not
medication?
take any medication. I became very sick.
Oh my goodness.
Very sick. That's where more of the other measures, alternative treatment came in. There's a herb within my family, we know, it's called Omieri. Do you know Omieri, the snake?
Yes, we know.
Yes, that herb. I will take a 5 liter of it.
Wait,
every
we
day.
know Omiri the snake.
Yes,
but
so there's a herb.
the herb named after Omiri.
Yes. I will take 5 liters and I was. And I remember taking the painkillers, maximum dose, the famous headaches. I will take even up to 6 per day. But hoping that the next one will meet with the previous one, then it will work.
Oh. And nothing.
I wasn't. Then the holiday finishes, I come back to Leonard, back to school now. I come back to school, very sick. Straight another 10 months in school up to October. No medical review. I'm very sick. But I'm still
No
in
medical
school.
review and no injection.
No injection. Very sick. But why was I in school? Even the school was concerned. It was the only safest place. Teachers noted like this is the only safest place for him. And for sure it was only the safest place. Because now from my knowledge, I know that those herbs could have done more harm, even damage my kidney, my liver.
Yeah.
Because my condition is I'm sick already and I'm adding some toxins.
You're straining your body.
My body to clear them. So they told this is the safest place. So that maybe that would keep me in school during this time. When I was sick, I'm supposed to be in the hospital or at home.
What did teachers say as far as because did the teachers know that you're diabetic
Yes,
now?
they knew.
They knew.
They
Did they ask? Did any of them ask? Do you have medication? Are you getting medication? Did any of them follow up on that?
Yes, they did. But again, as a teacher, what much can you do? Some of these things are private. Yes. Even some of those children or learners from well-off, they don't even bother. You only call the parent, then they're picked. Some of them keep it secret. I became very sick, very, very sick.
10 months up to October.
Yes, very sick. I gave up. Now the school got concerned. School nurse gets concerned. She makes arrangements, takes me back to Mbagathi. That's where I was diagnosed. That's the only link. Without even no guardian, no parent involvement.
Yes.
She takes me back there.
Yeah.
By then, I even had a foreskin infection. It's a common factor for boys. Girls, it's more of UTI. As a result of too much sugar passing through the urine, so it attracts infection.
Right.
The nurse organizes, I get circumcised in Mbagathi. No parental or guardian or relative involvement. She acquires two vials for 2 months. That's 2 months doses. It's around October, covers October, November, and the part of December.
Yeah.
I'm circumcised in Mbagathi, taken back to school in the school van, same day, around Ngong Road, now past the city, the Kenyatta area. The pain is now very hard. I'm going back to school.
Yeah.
I was nursed in school 1 month. Luckily, I healed very well. I did my end-term exams. I gave up. Now this is Form 2 now. Remember Form 1 diagnosis for the end of Form 1?
Yes.
The 10 months of Form 2.
Yes.
Form 3, I give up. I dropped out of school. I didn't go back to school Form 3.
Oh, no.
Yes, I gave up.
What made you give up?
The struggle, because even by then there was no guarantee of my medication. I knew I would go back. Now I'm getting some knowledge. I'm learning that I will still go back to the same condition. My performance is also bad. I'm in a national school. All the villages looking at you. Some of them are celebrating and saying that, yeah, I know.
Our boy has gone to a national school.
Yes, but he's not now able to cope.
But okay, so I can see you feeling the weight of the lack of medication and all. Did you have fees challenges?
A lot. The guardian withdraws, the sponsor withdraws.
Okay.
You apply nobody look at, because even performance, we are almost number last. Luckily, I was never number last, but we are almost there. So if you even apply, even CDF, I missed that. Yes.
Okay, so
What next?
what you should have been in Form 3, you don't go back to school.
Yes.
So you just stay at home?
I stayed at home, but people are concerned. Some people are concerned, but in Nairobi, not back in CI.
You stayed with the relatives.
With the relatives here. So some people are concerned. They will ask, what is happening? I will tell them that I will mention the issue of school fees, I will mention the issue of medicine. And they are not directed, they are direct and indirect at the same time. Because during this time, luckily, when I was in Form 2, my younger brother was in Lenana school from Siaya. So when I was admitted in the school after circumcision.
Yes.
Principal complains to the nurse, send the boy away. This is school, not hospital. But then I said, I don't send boys or students away. That's not my work. The nurse tells my brother, this one reaches me. It really hit me. So there were a lot of issues, performance, school fees, issue of principle,
yeah.
a lot of also a guarantee of medicine. So that's why some of the things which made me give up.
Right.
So I dropped out of school. In December, in the Deliverance Church Zimmerman, they used to have this conference every year, conference. I get to meet a guest, I share my story. I started sharing my story. He gives me 2,000, I buy 2 vials. So it carried me to part of December and January.
Right.
But again, I was engaging with people. So somebody tells me that I was willing to swap. I was arguing that I was a smart student. I can swap my Lenana because of the cost of the school. Even up now, it's among the expensive schools. For any school, for medication.
As long as, wow.
That was my argument.
Yeah.
Wow.
One of them was I was targeting maybe Kawasukari, Garis on high school, something like that. So that that money would go to my school fee and go to my medication.
Right.
Because if I made it in the village to Lenana, I can make it into any school to university. That was the argument. So I go back to school to seek clearance. So that I look for medication, I can also secure any school. My class teacher tells me, she was at DMI in our office yesterday. We are organizing an annual diabetes walk, 11th of July. She tells me, by then DMI was in Allingham. I went to some people in Allingham and they told me to take you there, they see how they can help. I told her, sure, I'm ready. We leave, we go to DMI. She leaves me there.
DMI?
Yeah.
Kenya Diabetes Management Information Center is a national organization which has been leading in type 1 diabetes and even type 2 diabetes awareness and most support for the children and youth. Up to now we are in all the 47 counties, 67 facilities.
Amazing.
Yes.
She takes you.
She takes me there, introduces me to DMI. We part ways, she goes back to London, I go back to my relatives. A few weeks, this medicine I had bought
Has
from
run
a
out.
guest from the Deliverance Church, the man, gets cleared. I go back to DMI. Now, the conversation started to change. They went to school. They had gone even to school. They talked to the principal. They put me into their programs. They had provided me with education, encouragement, and doing the medication and everything I needed. By then, we didn't have glucometers. I'm injecting blindly in the dark. I'm walking in the dark. I'm just injecting as prescribed. Whether it is high, it is low.
You don't know.
Just injecting. I don't know. But they promised. By then, they were putting us in a queue. You wait. When they get a glucometer, somebody can donate. Then you're given. You have to sort yourself to buy the strips. Strips are also going for around 2,000 plus, up to 3,000 for a test. So I get a glucometer, new one, very nice one. Still remember it. Yeah.
Hey, they took you back to school, you
No,
said?
they went to school.
Oh, they went
Talked
to
to
school.
the administration. Principal says that he has no problem with me going back to school.
Okay.
DMI tells me to go back to school. When they broke that news to me, I wept. Now the other issues came in. No, but this time I was focusing on the medication.
Yes.
Yeah. Now I start remembering the nursing, the circumcision in school, the principal's word, everything. I wept there. And I took the challenge. I prepared, and my things were still in school. I only had my backpack.
Yeah.
I goes back to school. When I entered Lenhana like this in the gate, it was around 11. People were going back to class from Tibrick. Oh, that one broke me. Up to now, I'm still broken with that.
Because you're back.
I'm back with a lot of struggles, but the rest of the boys it's alive as usual. When I left, Lenhana stopped existing.
To you.
Yes, it stopped existing. I go back there, and there's a very nice school, tarmacked pathways. I look at that against my struggles. Yeah, I went to the chapel. I cried.
Were you crying? Were you crying because of joy? Were
It
you
is
feeling
mixed.
a relief?
It is mixed.
Were you? It's all those things.
It was
all
mixed.
of them
First
together.
of all, I'm all alone. I've been away. I'm going to face the administration as a school regulations. I'm now in Form 2. I know very well every school regulation. You've been away, you must come back with a guardian or some report.
Yeah.
Where were you from? I have none. I'm all alone. You cannot just go to the class.
You can just come back.
Just
Yeah, go
walk
to the
in
class.
like,
You just left.
So I ended up with the dean of students. It was a lady. You don't know what question you will be asked. Like that's today, I didn't know what you will ask me. She asked me a question. What I can remember is, how will you cope? I know performance is almost down there. I have no school fees back. Now what is guaranteed is medication. She didn't ask me about school fees, which I didn't have an answer if I would been
if she had asked, yeah.
So how will you cope, my dear? Tough one. And she's a serious lady. We, kapa kumeumana. If I don't answer this one, it's enough for me to go home. We have not been talking about the issue of school fees.
Yeah.
Another one. What would have answered? What would have answered, Miriam?
What did you say?
I don't know what I would have said.
I said,
I honestly
I
don't
know
know.
what I want. Hey, what shocked me, I even got more confused. What followed? Go to class.
That was it.
That was it. Go to class. I even got more confused. I expect some engagement, school fees, blah.
Nothing.
Go to class. Where? Boss nilipambana. By then, even eyesight had gone, so I even have that prescription of DMI referring me to QI unit. I could, even sitting in the front, I could not see blackboard. I had a lot of chest pain. I was even X-rayed at Mbagathi. The legs, a lot of pains. Where? School fees was not talked about for the whole of that year.
Amazing.
Until the following year, Form 4, now the school fees issue. That's when the school fees issue came. They said, hey, kwani hawa watu wa DMI hawako wanalipa school fees?
You're ilikuwa insulin.
Yes. Nowhere we talked about school fees with DMI. I could not even tell them.
Yeah.
So nilingangana na masomo. Because I told Madam, I know what I want.
Yeah.
I remember DMI has also supported me. Form 4, after the mock, I'm among those who are suspended for poor performance. 2 weeks. Instead of leaving me to study, to catch up, I'm sent away. For 2 weeks, suspended. Now I go back with the guardian. Then they ask me, what is your target grade? What would you have answered? Now, this one to Eric, what would you have answered?
So you know what you want. Tell them what you want.
I know what I want. So I tell them A.
Yeah, that's what you want.
They laughed. That was the end of the discussion.
They're like,
They asked me, are you going to perform a miracle?
wow.
Fast forward, I cleared. I got a B minus.
Fantastic.
Yes, that's the story.
That's a beautiful story. There's so many things.
Yeah.
I stopped you, nilirudi back to going back to school. Hey, but ulikuwa umetuacha kwa glucometer. Kwa line ya glucometer.
I was given one. I would never manage to buy any glucometer, any strip. So I will use it occasionally. Get a piece, 2 pieces at DMI. I will use it. It remained as new as I was given.
So the glucometer works with strips.
With strips, yes.
So you put a strip now to test.
Yes.
Okay.
And a strip is
It's how
one
much?
test, one strip.
Yes.
And how much is or a packet of strips?
By then, over 2,000. The cheapest will be 2,000 by then.
How many strips?
50 tests.
50 tests is how many days? How often do you test?
I recommended is 8 tests per day.
What?
Recommended. Average 4.
What?
Yes.
So you're constantly monitoring your sugar levels.
What your brain, I'm assuming you don't have diabetes. What your brain is doing, that's what I'm trying to do.
You have to check,
Yes.
know, and then you know what to do.
Yes.
So, if you're testing 8 times a day, do you still inject twice a day? Or can you inject more than twice a day?
No, that currently twice a day is not even recommended. That was a shortcut.
Okay.
Now you inject 4 to 5 times a day or more. Myself, I inject 4 times a day.
At least 4 times a day.
At least 4 times a day or more. Yes.
Now,
And before injection, you need to check. To check. 2 hours after injection, because injection comes with that. There's one injection or 2 which you do independently, but there are 3 or more which you must do with a meal or a snack.
A meal or a snack?
Yes.
Okay.
3 or more injections.
What does what does this cost right now?
It's a lot of money currently because now they're in forms of a pen. The vial is no longer commonly available. They're what we call pens. A vial is 10 mils. A pen is 3 mils. So a pen of 3 mils currently costing average cheapest, best price is 2,000.
My gosh.
Discount.
how many injections does the pen go?
Yeah.
Okay, say you are injecting 10 times 3, that is 30 units. 300, it has 300 units. 3 mils is equals to 300 units. So 300 units divided by 30. 10 days.
10 days.
So a pen, 10 days.
Yeah, depending on your dose, yeah.
And that pen is
No,
2,000.
Well, a pen is 10 injections.
No, 10 days worth of
10
injections.
days worth
Yeah,
of injections.
like 10 times 3 is
And
30 injections.
And we're doing 3. We're averaging it at 3 injections.
Yes, 3 injections.
You do 4.
Yes.
So your pen is fewer than 10.
No, I have 2 pens. They're 2 different insulin.
Oh, okay.
They're 2 different. There's one which you do once or twice a day,
Okay.
which is called baseline. It forms your foundation per day. Then there's one which covers your meals, the carbohydrates in the meals you take. Yes. We call it basal and bolus.
Right.
Bolus is the mealtime injection.
And I'm assuming this gets more expensive if you do longer acting
Not
forms
really.
of insulin. It doesn't get more expensive?
No, they're the same. We call them analog, not longer. We call them analog insulin.
Okay, analog
Or
insulin.
modern insulin.
Okay.
Both of them are modern insulin.
Okay.
Yes.
So then they don't get more expensive.
The price is the same.
Oh.
They're both. It's really expensive. So okay, it can only get more expensive depending on where you're getting it. But already it's expensive.
Okay.
Yeah, it's already expensive.
I was asking because I'm thinking of these injectables for example, Ozempic, Wegovy, that are quite popular right now, and they're I think longer term, so like a once a week injection, or
It's different. They're not insulin.
they're not insulin.
They're not insulin.
Tell us.
They are not insulin.
Yeah.
They are meant for type 2 diabetes. They help your body to whatever insulin you have. You must have some insulin producing in your body. But remember, type 1, I said that there is no insulin.
There's no insulin
not
at
producing
all.
any. This is actually now injecting.
And some of the effect is you have to lose weight. And whenever you lose weight, also your body works better with the insulin available. That's how it works. That's why people are even using it for weight management.
Oh, yeah. Okay.
It is different. Yeah.
What's tickling you, Eric?
It's just the expanse of things that you must do just to keep yourself within.
Type 1.
Within.
What I'm telling people is it's like a talent. It's a full-time job. I tell people I have a full-time job.
You do have a full-time job.
It's a full-time. I don't even care about any other job.
This is it.
This is it. This is the job I do.
What's the youngest now? You now work with this organization, right?
Yes.
You're based with the Kenya Diabetes Management and Information Center. So this is basically an organization, a non-governmental organization.
Sure.
That helps people with diabetes, particularly type 1 diabetes. Is there any government entity that is equivalent to DMI?
Unfortunately, there is none currently, and also else being devolved. Yeah. So it will be very hard for one entity to control all the 47 counties. Because now currently, and we are working in that space, even whatever project we do, we have to engage each and every county. That's 47 engagements. So it makes it expensive event rollout.
True.
Yes, the best bet is now is the SHA or UHC, Universal Health Coverage, and KEMSA. Which should guarantee availability. KEMSA will guarantee availability of these commodities. Then SHA will cover the claim or the death insurance. Then the counties can now easily access those services. That's how complex it can get.
So now let's start with actually guaranteeing availability. One of the challenges that you were facing was that there was no guaranteed availability, right? That you'd go for weeks and months. Watu wanaambiana imepatikana mahali fulani. How is that situation now?
It has not really improved, though, because now we have a wide range. There is even the older insulin which I was using. So some people tend to go back to the older insulin, which tends to cushion them a bit, but still it's not good. It's like, I don't know, saying ukona, like as we grew up in the village, the mapera, the guava, it was all wild fruit. Like saying that because there is wild fruit, so there is no hunger.
I see what you mean.
So we have not sorted that out, right? In terms of just making sure that there is availability of insulin for the number of patients. Do you know whether the government knows how many people have type 1 diabetes?
For sure, I can say that one without any doubt. They don't know, because what guides the government is data. There's hardly data source for type 1 diabetes. What we have even now, if we go to internet, they will quote what I'm doing, the numbers we have in our program, which is around 6,700 last, but now we are at 8,700. That's what is quoted.
So DMI has 8,700.
Over. It is over.
Over
it grows every day. Yeah, it grows every day.
What's the source of DMI's data?
The program we roll out, the counties or the facility, they give us a monthly report, new cases and the rest.
And this is all type 1?
Yeah, that's only.
Only type 1?
Not all, only type 1.
From how many counties?
Across the 47 counties, 67 facilities.
67 facilities?
Yes. That's hospitals, yeah.
Public and private?
No, mostly public and 2 mission.
2 mission
hospitals. 10 mission hospital and cargo, is it human cargo? Cargo human in Kiambu.
Okay.
8,700 is the number that DMI has from the facilities that are, sharing data with DMI. And you're saying, just from working with DMI and just looking at government, it's unlikely that the government has any figure beyond this, beyond what DMI has shared with the government.
Last one year we checked, and there was nothing close to that.
Now, at the facility level, is there, to the best of your understanding, any sort of program of support to people with DMI?
Yes, there is. There is support in DMI. Like what we offer in Nairobi, we're currently giving them the modern insulin, the best available, the most expensive insulin, the long-acting, and the mill injection insulin.
Okay.
We give them glucometers, strips.
This is DMI.
Yeah, no, the DMI and partners, of course, partners are partners. DMI
with?
coordinating. We partner with Novo Nordisk,
Okay.
WDF. We have Roche. Yes, currently who are supporting us in providing those donations. Then DMI coordinates the distribution.
I'm
the
not hearing
reports.
county government of.
Yes, them they only reach they reach the clients and offer the doctor. Now we are using the facilities.
Okay.
Yes, that's the biggest contribution.
So the contribution of the county government is offering the facility, and the medics.
Yes, the medics.
But the
Commodities.
commodity has to come from donors.
Donors, yeah.
Who do this.
Yeah.
There's none at all that you'll find at a government facility.
What they're still providing is the older insulin, the guava, the wild fruits analogies. That's what they're providing, which is also on and off. Yes.
Not consistent supply.
No, not consistent.
What's the age of the youngest person that you know from this 8,700? What's the age range?
3 months old.
A 3-month-old.
A 3 months old. Diagnosed now around 12 years. There is also an 8-month who is also 23 years now. Though he's now abroad, he's no longer.
Okay.
Yeah. So the 3-month-old is now how many years?
Around 12 years.
It's now 12 years.
Yes.
Okay.
And the 8-month is now 23.
23 years.
What's the current youngest?
Current youngest, I've not checked because they're also growing today, tomorrow. But what I may remember, 1.5 years. That's the diagnosis. Some of the latest memories. 1.5 years.
Right.
Yeah.
1.5 years.
Yes.
A lot of people think of diabetes as a lifestyle disease. So then they think about it as a disease that affects older people, adults at least, at the very least. Walk me through diabetes, type 1 diabetes in children. 8,700 is quite a large number, but what predisposes children to it, and what are the things to look out for as parents, and even teachers actually, because we spend a huge amount of time in school.
Sure. So I'll just generally, diabetes is what we refer to as got multifactorial risk factors. So there's no specific
thing
with a lifestyle, because there are some people who live the same lifestyle, they don't get it all together. Some people live it and then they develop it. Some people even don't live a good lifestyle, they still develop diabetes. So it's a multifactorial issue that affects it. But for type 1, there is no lifestyle issue. It is an autoimmune, which are a bit complex.
Yes.
But there are environmental triggers. There are some analogy that there are seasonality of type 1 diagnosis cases, but we are yet to confirm, like in our some triggers, like, yes, like trigger with following a viral infection. As the body fights that infection, it could overreact, like in case of allergy.
Yes.
Whereby some harmless issues, things, particles just triggers somebody. So autoimmune tend to be triggered by following a viral infection, which can now make your body destroy itself again. There are several autoimmune conditions.
Yes.
And type 1 is the most common one, usually in childhood.
Yes. I think that distinction is incredibly important to make because, yes, what people know of diabetes is often type 2 diabetes. And then, yes, it's thought of as a lifestyle disease. It affects older people. So many misconceptions. But like you said, it's autoimmune. And it could be triggered by, like you said, infections, other environmental factors. But when you think of the signs that any caregiver, any parent, any teacher should be looking out for in young ones that could potentially be pointing them towards type 1 diabetes. I know you're not a healthcare provider, but you've done a lot of work in the space and continue to live with type 1 diabetes.
A correction, maybe Eric didn't share this with you.
Yes.
I'm a healthcare provider, nurse.
Fantastic.
Yes, and diabetes and qualified diabetes educator,
Fantastic.
Certified diabetes educator.
The better.
And we are only few in Kenya, not more than 10.
Yeah.
As diabetes
Not more than 10.
Yes, as diabetes educators who are certified.
Okay.
Others are just by out of experience. Yes, so what was the question?
Oh, yes. What parents, learners,
signs and symptoms to watch out
should be looking out for.
Yes, for the longest time, like what I said earlier, we have 3 common signs of type 1 diabetes or any other form of diabetes. Is persistent thirst. Why? Because they tend to pee a lot or urinate a lot. And they're getting to, it's a form of, because of that, the sugar accumulating in the bloodstream, it tends to absorb or retain water in the circulation. Again, body is trying to get rid of this excess water. Excess sugar through the urine. There's what we call homeostasis, a near normal, constant internal environment of the body.
Right.
So the sugar level should range between 4 to 7.8 or up to 8 maximum. But for somebody with diabetes, will go beyond, even if we talk of 11 plus.
Right.
So the body will trying to be getting rid of the excess sugar through urine, and that will also make you dehydrated. So you will tend to drink more water. Again, this
You
sugar...
said your blood glucose was at 22,
22,
when
yes.
you were diagnosed.
Yes.
That's
Yeah.
more than 4 times.
4 times, yes.
Almost 4 times. 3
Even
times.
the body had now just gotten shocked. What?
Go on.
The next one is because this glucose is the fuel to the body. But we are still alive. The body will try to look at counter-regulatory measures, start breaking itself down, breaking the fats first, then the protein. So they will be losing weight. So unexplained weight gain. And for a type 1, initially
Weight
they will
loss or weight gain?
Sorry, weight loss. Weight loss. And initially type 1, they will be having increased appetite because this food is meant for even including the brain, but it's not even reaching the brain. So the brain will be triggering, no, eat more. That's why the excessive anger will be coming in. I usually tell people that food is not meant for the bad taste, for your taste buds or for your stomach. It's meant for the cells. And when it reaches the cells, then you've not eaten.
If it hasn't gotten there.
Yes, you've not eaten. Like if you report and don't come to the studio, you've not reported work.
Yeah.
True.
So that's why they'll be feeling the persistent or unsatiable hunger. Not persistent, unsatiable. I've even used the example of, even if I will eat a whole sack of ugali, I will still be hungry.
You'll still be feeling hungry.
Yes, because...
But you'll still be feeling, not gaining weight.
Yes, in fact, I will even worsen. Because the more sugars, I'll be peeing more. And
The more you
working my
eat, the
body.
more sugar, the more you pee.
The more you become sick. Yeah.
Become sick.
Yeah.
The more you...
Yeah. So it's a problem. Then there are others now. Others are more of a complication now. Persistent infections. Like if a young boy who has not been circumcised, they will have foreskin infection. A young girl will be having more recurrent UTIs, pneumonia, boredom, loss of energy, lack of interest on the usual things. And then it will continue and progress to complication, even coma. So if they are treated and are not getting better, you can also suggest to the medic, can you also check blood sugar? Because it's not expensive, can be as cheap as 200, 100. Yeah. But most of the time people ignore it. Mtoto diabetes wapi. And I didn't even tell you a story. I went to the school nurse, April that year, Form 1. And the symptoms were classical, but he dismissed. I went to a doctor who will come every week in school. Wewe mtoto mdogo, hata umekonda, utatoa diabetes wapi? That's why these things were taking long to the diagnosis by then.
Okay.
So,
is there better knowledge among healthcare workers now?
Yes.
On diabetes, especially
there
type 1?
I can confirm there is a lot of awareness, including this show today. Yes, people will be listening.
Because I'm starting from level 1 of our healthcare is the community health promoters. Do community health promoters know about type 1 diabetes?
Yes, we've trained a number, but of course not, because there are also new people who are being onboarded. Somebody was onboarded last year, somebody retired from that service, and a new person has joined. So that's the only need, even for among the healthcare providers. That's the only challenge we have, because basically in basic training, diabetes is a very small unit. But it's a unit which can take a whole year, more than even a whole year to learn. While a nurse takes 3.5, now 3 years. Yeah. Diabetes alone needs 1 year. They are learning everything else, including theater. Yeah. So that's the limitation we have. Okay. Just need to change our curriculum, or see how we can. So what they have is a bit of it, which if someone does not use it in the next 6 months, it will just decay. Okay. Yeah.
Do they have ways of testing? Because see, the whole idea of a community health promoter is they are embedded in the community. And there are ways in which they are able to monitor. They are actually helping you to monitor your health. They'll come and they'll monitor everything else, blood pressure, blood sugar, tell you, advise you on how you live and how you adjust your life. Are they able to monitor and tell that there is a likelihood of diabetes here, but type 1?
Okay. The current model is good we call them community health promoters, but it is also new. Again, it has not been tested, tried and tested. Like you gave the example of Singapore. So it needs to be tried and tested. Again, consistency issue. And some of these things, they are political. So with any change, there's a risk of a new regimen then
coming in and then shake things up.
Change. But the big issue is consistency plus training.
Okay.
Yeah. So there's still a gap. There's a gap there. They could even be away. Some of those things might have expired. Because even when they were issued, then the training took even longer. We've also trained others, again, through another program, but it is limited. There are 12 countries which I'm planning to be trained in around by August to be trained. But again, knowledge keeps on changing. Again, catching up with the new knowledge.
That's good. I see.
So some of the gaps we face with such a setup.
Actually, yeah. My final question would be, looking outward, futuristically, what are the things that you are hopeful about as far as prevention and treatment of type 1 diabetes in Kenya?
Yes, I have a number of things, but one of these is demystifying the NCDs. That we should know that anybody, it's a risk that we share.
Yes.
There are no special people who get affected. But the fact that you're a human being, you face it like type 1 or type 2. And along with that goes that we can overcome it, whether we have it or through prevention or through management. Third one is the universal health coverage, or our SHA covering. Imagine somebody being, leveling a bit at 1 year and targeting to, or supposed to live 90 years. That cost, that is more than taxation.
Lifetime cost.
It's like lifetime jail, being in jail or imprisonment. So government and other partners should come in and cushion them.
I agree.
Yes.
Does SHA cover anything?
Yes, it covers a lot, but again, it's much limited, and some of it is in theory. Again, it covers in public facilities better.
Of course.
What does it cover?
Yeah.
It covers tests, but only one test. For example, one test, a test which a person needs to do every 3 months, but it covers like only one
per year.
Yes. You look at the coverage of tests, is like around four last time when we checked, around 4,000. Or initially it was at 4,000. A test can go even, some people, like in private, they can even take a test of 40,000 in one visit. It does not cover the analog insulin, the modern insulin. It covers the older version insulin. And if it were to cover the modern insulin, are they available? These are only available in private chemists. Even some private hospitals don't stock them.
Right.
So that's some of there are a lot of limitations.
Does it cover a full dose of the older insulin? As one may need, or does it limit?
I'm not sure, because also there are a lot of gaps with it currently. Some places recently, so some places it's not even working altogether. So it will be able to cover, but again, if there's no supply in those facilities, that already is a gap.
True.
There is a shortage, which is very common again. Yes.
Oh gosh. Thank you so much for spending the morning with us, Eric. I think it's good that from a diagnosis thanks to a hospital visit, from being in school to now being a healthcare provider and a champion for type 1 diabetes awareness, especially in children. It's a wonderful, wonderful thing. You're a fixer, a proper one. So thank you for making time for us this morning. Nakazi safi sana. We'll continue talking about type 1 diabetes and creating as much awareness as we can. We're about to end the show now, but we will leave you in the capable hands of the team at Your World. Leo ni Winnie wako in studio, and we'll be leaving you also in the capable hands of Claudia Naisabwa and of course Brian Aseli on Nation FM. Much as Hollywood are being discussed on NTV, Pale Your World versus Riverwood.
Our own.
Let's talk about it. And of course, we leave you, like I said, in the capable hands of Claudia Naisabwa and Brian Aseli on Vibe Shift on Nation FM. From myself, Mariam Bishar, Eric Latif, and Falaris Wamboi in absentia, have an amazing, amazing Thursday.